Health officials are watching a new COVID variant of interest called MU. Experts aren't worried about the variant at this point, but this comes as cases are rising and hospitals across the United States are becoming overwhelmed. Emily Tayler reports.
Well, millions of Canadians and Americans are celebrating this Labor Day weekend. There are concerns that increased travel and large gatherings could spark another COVID-19 surge. And hospitals in some states across the U.S. are already overwhelmed with patients.
We are setting case records. We have a record number of Kentuckians in the hospital battling COVID, in the ICU battling for their lives.
Just under 100,000 people in the U.S. are hospitalized with COVID-19, according to data from the Department of Health and Human Services.
Some of it has to do with the fact that there's been tremendous disinformation campaigns and people are believing things that are simply not true.
Health officials are keeping close watch on a new variant of interest called MU.
Right now, it is not an immediate threat.
Federal regulators are considering the possibility of authorizing a booster shot in the U.S. within the next few weeks. Dr. Anthony Fauci told CBS that the White House would probably roll out at least part of its booster plan the week of September 20th. But the vaccine plan will have to get approval from the FDA and sign off from the CDC first.
The good news about our vaccines, if you get the level of antibody high enough, which boosters actually do, then you can feel pretty confident that you're going to be protected against virtually any variant.
McMaster University infectious disease specialist Dr. Martha Fulford says it's important to note that it's a variant of interest, not of concern.
And I actually find it reassuring that, in fact, we are checking, we're monitoring, and that as the virus adjusts, we are actually tracking that. Most of the variants so far have only been called variants of interest because they've actually turned out to do nothing.
Emily Tayler, CHCH News.